Hi, welcome to the Hellstorm. I'm Vic Gatto, your host. Today I have Bill Brown with A2B Advisors. Bill is a great person. I've known him for probably 15 years. He's a really successful three-time entrepreneur turned CEO. Now he advises others through his consultancy. We talk about technology in healthcare, the adoption curve, how COVID-19 is affecting all of us and going to change healthcare. It's really an interesting show. Please watch it. Bill Brown with A2B Advisors. Thanks a lot. Hey, Bill Brown, thanks for joining me on the Hellstorm. Excited to have you here.
Likewise. Looking forward to it.
Yeah, it should be fun. Kind of unprecedented times. It's good to have you on in the middle of the COVID-19 lockdown. I'm here in my guest room / studio.
Yeah, we're sitting here talking to each other, and we live a mile and a half away from each other.
That's right. But we're social distancing like we're supposed to.
Yeah.
So first, just give the audience, we've known each other for a long time, but give the audience a little about your background. Maybe starting at Entrada or how you got involved in Entrada, and then A2B Advisors.
Will do. So I'll step back to the beginning. I moved to Nashville in mid-'80s with finance and accounting background and made a pivot in the late 90s and actually spent 7 years running physician networks. And was pretty good at it. Was actually good at raising performance and profits for the groups. Had a great time there. Eventually became CEO of the company. But the key point of that is during that 2000 to 2003 timeframe, we were a big early adopter of electronic health records, which gave me a huge early warning indicator that when the HITECH Act was established in 2009, what kind of chaos we were going to be in for with an accelerated push out of those into the market. And that's what led me to Entrada. After we exited the physician practice management company, I spent a few years doing consulting and eventually became CEO of Entrada in the fall of 2010. And Entrada was a health IT app that we had on smartphones that would sit in the doctor's pocket and help them with their electronic health record optimization and workflow as they went throughout their day interacting with patients. And ironically, both in and out of office. And we had a great run. I think when I took over, we had about 100,000 annual revenue. We won a lot of Best Places to Work awards, got a patent for the way we manipulated data on smartphones, made the Inc. 500, et cetera. But eventually, in the fall of 2017, we hit around a $13 million run rate, and we sold it to one of our business partners.
Yeah. And I think
I stayed through.
One of the things that I think about you that I think Entrada was emblematic of is it was a great product and a good team that was hustling and trying to figure things out.
Yeah.
But they didn't have the process and structure and ability to really scale to the next level. So you sort of brought that in. I wasn't involved in it, but that was my view from the outside.
Yeah, it was. It had been 4 years old and it just reached 100,000 in annual revenue when I came in. So it was pretty much mired in quicksand with some good ideas. Yeah.
Right.
We helped it take off.
Yeah. And then talk about, since then you're doing your own advisory work, A2B Advisors. Talk about that business, like where you like to get involved with companies and how you help.
Yes. So it's pretty simple. My tagline is help leaders accelerate growth. And I'm a firm believer that if you put process and structure in place, it helps creativity and it helps you grow faster and in a much more focused way. So I've got a 7-step planning and execution playbook. It's tied around clarifying goals, putting in place strong operating processes, and growing faster. And a lot of my emphasis is working with companies and drilling down into that market opportunity to make sure that you're taking your strengths and hitting the right target market with the right message. What I see a lot is all of us when we're starting out, especially early stage, but even as we hit the 20, 30, $40 million revenue rate, you're so afraid of missing out on any revenue opportunities. You try to sell too many things to too many people and it can dilute your message.
Yeah. Okay, excellent. So I know you're a big athlete. You have it's a great backdrop. You have all your awards behind you there. You've been running marathons and long distance races for a long time. I'm interested in do you think that the structure and discipline that it takes to sort of be an elite marathon runner or run, I don't know how many races you've run, tell me in a minute. does that translate to helping teams think about process and structure and discipline to achieve maybe a different set of goals, but their goals?
Yeah. Oh, absolutely. I'm 56, and when I turned 40, I parked all my team sports, had young daughters. I was still traveling some, so I just started ramping up my miles and running distance races to have something to work toward. And I think since in the last 16 years, I've run about 25, 26 marathons, and my God, I guess maybe 100, 125 half marathons. And for years, I just ran miles. And about 4 or 5 years ago, I got really focused on the science of running, started following some discipline training plans, focused on weight and nutrition, and then hired a coach on several occasions to lead me up into the months before a key race I targeted. And since then, it's taken off. I think in the last 4 years, my PRs, as we say, or personal record in all the distances I've broken them all 4 or 5 times. I've taken my time in a marathon down by about 32 minutes, and wow. I'm fighting Father Time, and Father Time's eventually going to win, but I know I've got a couple more gears to go here over the next 3 or 4 years.
Yeah, it's interesting. So, when you stop just sort of pushing with energy and just like drive and start being a little more intelligent and thoughtful and planned, you can do much better. And I think there's an analogy for young high growth companies that often like the force of will, or they're just like running through walls. But it makes sense to me that if they plan it a little bit and kind of use your step-by-step program and map things out, then when the effort goes in, it's channeled better or it's more effective.
Oh, absolutely. In the last 4 years, I don't spend any extra time training as I did before. I'm just doing it better. Yeah. And same way with executing with companies. Yeah.
Yeah. Okay. So as you know, this is called the Health Storm. I launched it about 6 months ago with the idea that I saw healthcare really changing in the next 3 to 6 years and being disrupted and remade with innovation. And then, of course, the COVID-19 epidemic is here. Yeah. And we're all rethinking healthcare. I think the storm feels like it's here as I'm sheltered in place, trying to survive the storm. But I think the concept is the same, that healthcare is going to be changed pretty dramatically. I think it's now accelerated a little bit. But I want to talk through the drivers that I saw previously that led me to start this and just get your opinion on them. So, I mean, the idea is that there's 4 drivers that sort of are coming to a head now that are going to move things. I mean, obviously, healthcare is a huge industry, $3.5 trillion. I mean, you and I are in the middle of it. I really think that the rise of the consumers are trying to grab more authority, more control, more information, try to make decisions. They're trying to gain power and look up things and then be more of an equal partner with their doctor or their advisor. So that's the first one. The second one is that technology tools, so telemedicine, artificial intelligence, delivery of services, kind of rides, automation, all these things that have really changed every other industry are now coming to healthcare. The third is the care moving out of the hospital and to the neighborhood or the home. So it used to be that everything was done in the kind of the tertiary medical center inside the 4 walls of a hospital. And now you're having many procedures can be done in a surgery center or in the neighborhood mall, like strip mall, or in your house. And it's better for patients and less expensive. And then the last is that I see a bunch of market entry, new players, Google, Amazon, Walmart, that are jumping into the space that you wouldn't have thought were healthcare providers, healthcare companies 10 years ago. Now they're moving into it. Give me your sense of these drivers.
Oh, I think it's going to accelerate in a big way, and there's going to be lasting change. If I step back for a minute and look at it globally, I think we're going to have an interesting transition period, because first, I think we're all heading for a big financial hangover here with what we're all dealing with COVID-19.
Yeah, I mean, you had a
think
hard
when we come out of that,
$20 trillion economy. Yeah.
Oh my gosh. And when we come out of this, I think the first thing everybody's going to do is kind of catch their breath and dip their toe in the water, getting back out, and actually probably worried about just financially getting back in order.
Yeah.
And here's where I think it gets interesting with healthcare. I think one of the primary, this is just me, but I think one of the, you know this well as anybody, healthcare has been slow to adopt change over the years in the U.S. And I think one of the primary reasons is we tend to follow the financial reimbursement rules because that dictates how we kind of conduct business.
Yeah, I mean, that's how you
that's how you make your money. And historically, fee-for-service reimbursement has paid much more if you do face-to-face visits than telehealth. So what are the physician groups going to do? They're going to keep having you come into the office. Well, one of the things that's come out of the SAFE Act is they're starting to normalize the payment, whether the visit is conducted, electronically or face-to-face. That will be a big accelerator to help move this forward quicker. And then I look at like this right here. In the last 3 months, I started wearing a heart rate variability monitor. Yeah. And I'm getting data every day on what kind of strain I put on myself with workouts I did, how I recover and sleep that night, and how rested I am when I get up the next morning. And it's forcing me to look at how, if nothing else, how long I've been sleeping. But it's even to the point that I've drilled down to, if I do a weightlifting session after 5 at night, and I typically go to bed at 9, I know that that's going to affect my sleep that night.
Yeah.
So now I'm starting to dig into, okay, what can I help do to offset that? And something as simple as silly as this sounds, is maybe a 2-minute cold shower after the session may help calm my body back down. And that's the kind of stuff that 4 or 5 years ago was unheard of.
Right.
Getting that kind of data at your fingertips.
Yeah, I mean, I think it's interesting to think about how this epidemic will impact sort of the adoption of technology in healthcare, right? Like a lot of the adoption curve has been kind of slowed down, not due to the technical capabilities, but due to regulation or reimbursement. And so one of the things that has been incredible over the last 30 days is CMS has lifted all the state-to-state physician requirements. And so it used to be that if you had rights to practice in Tennessee, you couldn't see a patient over telehealth in Kentucky. And now that's all gone because it's wartime and we have to find a way to treat these patients. I don't think it's going back. I think it's here to stay, and it's going to be 50 states across the country.
Which that always never made sense to me, but every time somebody would come up with a new type of treatment, they had to go state by state to try to get it done. I mean, heck, look at telehealth. You mentioned it. A good friend of mine was the chief medical officer for Teladoc for several years. And I remember just 4 years ago, they were spending an incredible amount of their time just fighting lawsuits in the state of Texas from the Texas Medical Association, trying to block them from doing telehealth visits in the state. I mean, that's gone.
It's really just like protectionism. Like people in various lobbying groups, they're trying to stifle innovation.
Yeah.
And maybe it helps a very small group protect their income for a few months, but it hurts the overall public. And something like this epidemic, I think, allows you just to see through that and push through it and bring it for the better for everyone.
Yeah.
So
telehealth's going to be really interesting. Go ahead.
You saw the rollout of a lot of technology in physician groups. Talk about that dynamic of if the reimbursement comes and the regulation is there, will they adopt technology, doctors?
If the reimbursement works and they can find a lot of it's workflow driven. Doctors, we don't fully appreciate the sheer intensity of everything that hits them during the day. Yeah. You know how I'll give a silly analogy, but I read this stat in a book I read that for parole hearings,
okay.
65 to 70% or more of the hearings that are done first thing in the morning get approved. 5% of the ones done after 4 in the afternoon get approved because they've got mental fatigue by the end of the day. Yeah. So I think we've got to do things in a way that we don't add pressure to the doctor from adding on to the deluge of way they're getting hit with everything. And that's making the data that they're getting digestible in bite-sized pieces.
Yeah.
And the initial inflow of the electronic health records, and that's one thing, and Trada did a nice job with. We put clinical data on the smartphone, and we did it in a way a doctor could share it with another doctor, but it was just 5 or 6 snippets out of the chart of key information with the idea that if you had 90 seconds to get up to speed on a patient, this is what I'd want to see. And the traditional care summary that got passed on was 6 pages of information. You had to try to sort through and find it. And so, I mean, when the Medicare started acknowledging in the primary care arena that if you had comorbidities and did work outside of the office, they would start paying you an extra reimbursement if you could prove that you've done 20 minutes a month of care. And but then the physician groups had no way to log and track and provide a backup for that care delivery. So all these companies came up that raised big money and was going in and doing it for them, and we had a lot of bankruptcies there because it was you know how it is a lot of times with the first realm of change agents take it on the chin, and the ones that come along behind them reap the benefits. Yeah. You see that a lot in construction. You know, when you redevelop cities and all, we're experiencing that in Nashville. And I think that's what it was there. We've had that wave of companies that tried some of these technology innovations first time around, and a lot of them have taken it on the chin, and now we're ready to reap the benefit of that, kind of learn from some of our mistakes. But I just keep coming down. It's going to be the way the data is pulled together and presented in an easily digestible format. It's going to be critical.
Yeah, and I think for any human, but of course doctors are humans,
Yeah.
I want to have better access to information. I want to have my day be easier, more convenient, more effective, faster. I want to get more reward, more fulfillment out of it. I don't really want to use a new technical tool unless it does those things. And I think physicians are the same way. They're trying to get through their day and affect patients and impact their lives and cure them, but they also need to deliver what's needed for the practice. And the electronic medical records came in, and I think it was a decent first step to get everything automated and digitized.
Yes.
But it caused a lot of pressure on the docs from a coding point of view, from an entry.
Yeah. And we had to do something to get everybody in the game on electronics. Also, I give the government a lot of kudos for that. But what we did do was, the phase one of this was basically we spent $30 billion accelerating rollout of a bunch of software that doesn't speak to each other very well.
Right. Yeah, we created
and because of that
in the process.
Yeah. And just recently, and I think the CMS has done a great job in the last year or so of shifting that focus away from a checkbox, are you collecting certain data, to now we got to focus on how you're sharing that data and making it digestible by others. So I think that transition is underway, and that's going to be critical to what I'm referring to in this next step. I think ultimately, you as a physician, your core source you go to probably will not be your own electronic health record, but it will be the repository you're pulling that and information you're pulling from outside sources into in some kind of we'll call it a patient record for lack of a better term, but patient digest.
Yeah, it's some kind of like overlay that pulls information out of all the different systems into one high level you can interact with. I mean, I think the way I think about it is the lab systems that hospitals have, they no longer are, there's no interface to the lab systems directly anymore. They're still there.
Yes.
You access them through the electronic medical record. I think it'll be the same way, but you don't unplug the EMRs because there's so much data and money and effort in there.
Right.
Build an easier interface that pulls in data from lots of places around that. I think that's Google. I think Google's doing that right now.
Yes.
But I see them doing is sort of an overlay on top of those.
Yeah. And we know Amazon's experimenting with something behind the scenes that they haven't unveiled yet.
Yeah, right.
I think their first big push is letting pharmaceutical, prescriptions probably be a driver to drive traffic. But I'm sure there are other things they've got looming too. But I think you're right there. And And it's been interesting because the first foray that both Google and Microsoft took into this, they started and stopped with.
Yeah.
But I think that's part of the evolution of change. You try something, you learn from it, you retool, and then you go harder again.
Yeah. Yeah, it's interesting. So talk to me about timing. Like, I think in healthcare, really timing is the thing, right? It's pretty easy to know this storm is coming and these are the changes that will happen in the next 5, 10, 20 years. I can paint that picture pretty well, but I'll lose a ton of money if I don't understand the timing of it's A, then B, then C. And so talk to me about your view of timing, given the technology markets, but also COVID-19 and sort of probably the massive shift in the zeitgeist and our culture towards public health now.
Yeah. I think one of my analogies I use a lot, my former colleagues like to laugh about 4 or 5 of my pet sayings.
You have these analogies. Everyone knows that.
Yeah. Is that 90% of the fuel in a rocket ship is used in the first 30 minutes of a flight to get out of Earth's orbit. Yeah. And then it becomes smooth from there. And I think telehealth and some of these new tools, like I just talked about, have been fighting to get out of orbit, and probably this crisis may be the impetus that pushes them out of that. Yeah. But I think I'm going to go back to simple knitting here. I think there are maybe 3 things that are going to determine what this accelerated pace looks like. And I come back to what I said earlier. I think the first one is reimbursement. You know, reimbursement has been slow to come around. It's been a state-by-state fight, as you talked about earlier. And in many cases, we're still paying everybody based on volume. And the faster that we can get more to a value-based care, that's one of those buzzwords that gets overused a lot, but I'll call it risk-based reimbursement, where the provider of care, what they make from the interaction goes up or down depending on how well they do their job. That's going to accelerate things. Secondly is figuring out the right balance of regulation versus overregulation with HIPAA and privacy. Yeah. You know, I think it's reached a point that people got so afraid of doing a HIPAA violation that they were afraid to try things new.
Oh, there's no question.
I'm not downplaying that health data privacy is a valid, important concern, but I think we probably went a little overboard there. And then third, it's just human nature. You know, we're slow to change habits. I use my family. We've never done a telehealth visit till recently.
Yeah.
You know, and I've been a big believer in it from the get-go. And even when my daughters were in college, I couldn't get one of them to try it. Now they're open to it. Yeah. And so, you know, I know one telehealth company in Chicago, for example, that their entire, grown a very nice sized business, their entire customer base is self-insured employers who they became a telehealth option with their network for the employees and their families to try to, you know, cut down on lost work time and get treatment quicker before they get very sick, et cetera. And they identified early on one of the big challenges was low adoption rates. So they basically, for the last 2 or 3 years, have given up their entire profit margin by bringing extra people in, you know, nurses, call center type people, and really reaching out and interacting aggressively with their clients to get the adoption rate up. And that's going to be one of the challenges here with telehealth. You know, most of the telehealth companies today are not making a lot of money.
Right.
You know, but that's understandable. You know, early on, you're really worried more about adoption and grabbing some market share. And so we got to help them get there. And by leveling the reimbursement is one step to where it can be a good business for everyone. Yeah. So I'd say 3 things: following what they do with reimbursement and how aggressively, getting a good balancing act with privacy, and then really seeing how fast people adopt new habits here are the 3 I'm looking at.
Yeah. So I've been trying to figure out how this crisis then evolves. Like, people are still getting really sick and in critical care and in ICU. I think it's sort of all hands on deck, and we have to try to treat people and contain the virus. Then, so I'm calling that the crisis, where we're right in the middle of it now. But then I'm talking about recovery and new normal. Like, there's going to be a time when we are healing as a nation. We're trying to figure out what should we do differently. We're recovering. All of our businesses, every business in the country has financial disruption, needs to recover. All the hospitals need to recover. So there's a time period of recovery, and then there's what I'm calling new normal, which is, okay, now I've used telehealth, I've done this, I'm comfortable with it. What can I use it? How can I use it as part of my normal care that I think will come around? Talk to me about, when do you see the crisis phase shifting to recovery? What's the timeline? Is that a few months? How do you think about that?
I think of it as probably a few months. I think we're going to have a period of time when we get out of the crisis. Warm weather is going to help there, and everybody's going to catch their breath. They're going to try to figure out, okay, how do we just get everybody back engaged, get used to being back in offices together and all that. And then they're going to say, okay, now what do we do different? And about that time, my guess is, I'm not a medical practitioner, but my guess is sometime this fall, we're going to see a second wave of this when the weather starts cooling down again. And hopefully by then we will have respirators and masks and testing kits well stocked throughout the country. Enough, ironically, one of the issues we had is a lot of hospitals, when they got more respirators in, they found out they didn't have enough people trained in how to administer them.
Yeah.
And so hopefully we'll be prepared for that this next time around, and it won't be this isolationism we had to go through.
We had all the testing and respirators and preparation. It's a scary disease in how fast it's contagious, how fast it can spread, but it is treatable, and so people will heal and recover in large part. I mean, if you have a lot of underlying conditions, you're not healthy to start with, that's a challenge. But the real concern is sort of too many people coming into the hospital at once, and we don't have enough respirators, don't have enough support.
Yeah. Hey, let me ask you a question too. One thing that I was debating with a couple of other friends in the industry is, this is the first time around a tremendous number of people have tried telehealth. Yeah. And I'm wondering, because these companies have been hit overnight with ridiculous demands. And there's probably the experience has probably been hit and miss for a lot of patients. So I wonder if that's going to make people reticent to try it again, or if they realize, hey, this wasn't as bad as I thought, even though it had some hiccups. I want to keep going in this direction.
I don't think we know that in any factual way. My guess or my hypothesis would be that just the trial and the frequency and the idea that I did this and I saw my doctor and I got an answer will outweigh any technology snags. So it's a positive, and I think it drives more adoption rather than less. But I don't think anyone has facts about that yet. That's just my belief system.
I think just the act of going through figuring out how to use your computer to engage with your doctor probably was a big positive for most people.
Yeah, that's right.
So I think,
and I think we're just getting comfortable with virtual meetings in general. Like I had a reunion with some of my college buddies over Zoom, and I think a lot of people have done this, where like we used to meet once a year, would go to a weekend or something, and we just did it on Zoom for fun. And I never would have thought about doing that, but it was a good time. And so you get used to the interface and the environment, and then it's easier to apply it to a healthcare need.
Yeah, it's a weird time we're in.
Definitely. So tell me about your view of where hospitals and health systems sit in the new normal. So like a couple of years from now, as we get through this, are they the center of the value to patients, or are they wearing a bullseye and get sort of, they're still there, but like a lot of the margin gets pulled away from new entry and other players?
Yeah. I tend to think the latter. They're still there, but they're going to, if they don't evolve, things are going to change around them faster than they can handle. And that's not to say hospitals are not valuable parts of what we do and key parts of our ecosystem, but I just think we're going to move upstream and we're going to try to address things much earlier in the process before things get chronic and they have to be admitted. And I also think that what's going to come out of this are winners and losers, depending on who has the stronger balance sheets.
Yeah.
And
that's something
the financial results.
Coming into this, most health systems and hospitals did not have a strong balance sheet. There's a few exceptions, but in general, out of the 5,100 hospitals, there are a couple hundred that have a strong balance sheet. Most of them are month to month, and this hasn't. Yes, there's been federal stimulus, but this has been pretty hard financially on hospitals. Yeah,
and here's where I think it gets interesting. Is I think the ones that are setting better financially right now are the insurance payers.
Mm-hmm. Yeah,
and there's a little bit of we've all heard the term the law of unintended consequences before, which basically means some unanticipated outcome of an action that was taken. And I think, I've benefited from that and I've been bitten by that. And I think, when the Affordable Care Act was passed, which a lot of people refer to as Obamacare, but when we passed the Affordable Care Act and started the healthcare exchanges, et cetera, there was payers were treated a little bit like the villain in that law, and well, not a little bit, but more than a little bit. And there were some actually mandates put in place around how much profit margin they could have, which it just fascinated me that a whole sector of the industry would be singled out there. And because of that, they had to get very creative about what they did, spinning up additional management services. And then they have already started acquiring their clients or their delivery networks. There's been a lot of examples of big urgent care chains or big networks of doctors.
United is the biggest employer of docs, I think, in the country right now.
Yeah, they bought several huge networks from DaVita just 2 years ago. A friend of mine worked in there, and he switched over to being a part of United, and so I think that's going to just keep accelerating.
The Affordable Care Act put pressure on payers, but several years ago. So they have now responded to that, and the hospital systems didn't have that kind of impetus to change. And so as I think about the trends that I see, I think having a strong balance sheet in this time of significant financial pressure from COVID-19 is going to be an important thing. I also think that as the rise of the consumer happens, knowing how to have a brand power and talk to consumers and do marketing, that's going to be a skill and a kind of capability that one needs. And the health systems are not really strong at that. Payers and tech market entrants or someone like Walmart, they are much better at branding and talking to consumers. And then when you go to technology and convenience, again, the health systems have been protected from that. They haven't really learned those skills that well. So they're a little behind. That doesn't mean they can't catch up, but they're not in the top position for the race right now.
Mm-hmm. Yeah, so I think that's going to be important. I think it's going to be really fascinating to see what the consolidation is. And if you overly simplify this, one challenge we've always had in our for-profit health arena in the U.S. is we had a lot of people wanting a slice of the pie, from the payers, the providers, et cetera. And as you get more consolidation of the actual people that the insurance payers or the people bearing risk and the delivery networks performing the care, then it aligns incentives if done right, so that the same person who has the risk is delivering care, you would think better things would come out of that.
Yeah, it should be aligned interests. You ought to be able to reduce the cost through scale and less overhead as well.
Mm-hmm. Yeah.
Yeah, I mean, I think there's going to be a lot of consolidation. I don't think we need that many hospitals as we have, and I think the fractured system is not helpful on a bunch of fronts.
Yeah, and it's going to be interesting how thinking evolves. Like, you've heard all the press here where we are in Tennessee in the last year or so, where people are complaining that some of the really, really small rural hospitals have shut down, and what a travesty it is. Well, yes, the more rural areas need proper health care, but it's probably not, the answer is probably not that 20-bed hospital that shut down. The answer is probably some good outpatient centers where you can catch people and do some really good outcomes-based things earlier in the cycle before they
need the small hospital. I mean, now there is a pain point in that a lot of people lose jobs. So
yes,
usually the rural hospital is either the first or second top employer in the county.
Yeah, that's true.
That's the real pain point. I don't think it's going to be a negative to patient care. I think that urban hospitals or an outside player can come in and set up a freestanding ED and a surgery center and some other support services and deliver pretty good care without having a full hospital, and then pull in people to a more of a regional hospital.
Yeah, I mean, I lived through that way back in late 90s and early 2000s. I was running physician practices. We had some markets that were 20 and 30 miles out of larger cities, and we actually had specialty groups rotating through and spending time in the clinics and delivering care there to try to help bring the proper care to the markets.
Right.
Yeah. Yeah, I even had a market in one rural market where oncology group were coming in to do their chemotherapy, and a very comfortable lab we set up for them so that the patients didn't have to drive 20 or 30 miles or longer, deal with the intrusive chemotherapy, and then have to be brought home while they're feeling bad.
Right.
You know, we brought it to them, and that's the kind of stuff I think we could easily do today and drive harder.
Yeah. Yeah. So, I mean, it's going to be hard for the employees at those hospitals, but for the patients themselves, I think the system will deliver almost a better product to them.
Yeah. Yeah.
So, okay, good. Well, so talk to me about, you've been in health innovation through a variety of different ways for several years. What do you know now that you wish you knew at the start? So when you started.
Oh, gosh. Oh, if I talk about, I was what I would call a late bloomer, Vic. I didn't really shift into what I would call entrepreneur-driven growth companies until I was 33, 34 years old. And over the years, I've learned a tremendous amount about how to use structure and process and planning to drive growth, and how to speed up the pace of decision making. How many times have we made a decision that our gut was telling us 9 months ago we should have made all back then? And so if I wish I'd have done anything different from the beginning, I wish I'd have started that journey much earlier, more like right after I came out of college, and just taken that way I'd be much more equipped in my 40s and 50s to go even stronger and better, and I would have gotten some of my learning lessons over quicker. Yeah.
So talk about that decision-making process. I mean, how do you get it from, I don't know, it's in the back of my mind and I know I should be making this change, but I don't really focus on it, to get it much more like front and center? How do you go through that process?
I think you've got to have scheduled planning time where you get out of the fray and really think about things instead of getting caught up in your day-to-day whirlwind of constantly getting your work done. I mean, being an executive is like playing a game of whack-a-mole, where that old game at the Chuck E. Cheese or whatever we all do with our kids. You knock one thing down, another one pops up 3 or 4 feet over. Next thing you look up, 5 minutes have gone by, and all you've done is whack the mallet. And a decision's got to be made. A lot of times it's personnel. A lot of times it's putting something new in place. And you sit there, and it's natural to procrastinate if it's going to be involve change or be a hard decision. And then you just get swept up in the day-to-day, and next thing you know, you look up and you're having the same conversations with yourself as you did 6 or 8 months ago. So I think that personal planning time has got to happen.
Yeah. And so you carve it out in a daily, weekly. How do you try to design it?
I wish I was as disciplined as I talk like I am, but I'm getting back better at that. I think scheduling a weekly quiet time with yourself, where you schedule to be isolated from everything, phone silenced, and just really think through things is important. And number two is keeping a diary or a log of big issues that you need to be dealing with, so that it's just not, there's some structure to what you're doing. And I think having this is a self-centered thing to say, because I do, training and coaching activities now, but I do think having some at a minimum some peers or some third parties you can go to and have regular conversations with to force your thinking to go deeper. And it's people that aren't in your business with you.
Yeah.
Somebody that's seen things more from.
Accountability is important on all fronts, right? Like it is, particularly for the CEO. There's obviously a big willingness to say to a director, who's your set of bosses, I'm trying to do these things, I'm not that good at them, can you hold me accountable? That's a little scary. But if you don't have some coach or some mentor or a peer, you could go many months or years without really being accountable, except for that quarterly board meeting where it's, it can be really helpful and partnership with the board. It also can be kind of a show where you're presenting what you want people to see, but you're not showing all the stuff behind the scenes.
Yeah. You never want to have all your cards on the table. It's a balancing act, and that's if you look at that balancing act at your board level, you only want to go to them when you're at a minimum presenting things on your best foot, and that takes time to get to that. And like you said, you're
the options, but you should have thought through the different options.
And then to your company, I'm a fairly open book guy. And I've been taking advantage of that in the past, where I've been a little too open with some people underneath me, but I also think it's the right thing long term. But there's a balancing act. You can't just go dump down everything you're thinking to your company or some. People react to every little mood change by the CEO, and so you got to balance that.
Yeah, I mean, I find so. I'm one of the two co-founders at Jumpstart with Marcus Whitney. And so Marcus and I, we have different views of the world, but we respect each other, and we're the two co-founders, right? So neither one of us are like over the other. And so we can hold each other accountable and challenge each other in a way that an employee really can't, even if I'm open, an employee can't do as easily, just because it's not the same relationship.
And not only that, but your key employees who you respect and are great people, if they're not sitting in the shoes as the main guy or lady running the company, the level of accountability and intensity you feel is just not the same.
Yeah, right.
And you need that third party trigger points to really force you to move things forward quicker.
Right. Okay, and then. Talk to me about other things you see in healthcare, other trends or other innovation themes that you see on the horizon.
Oh, there's two or three that I think are going to be fascinating. And one is how we deal with stress and mental health.
This shelter in place and contact is making behavioral health much worse in general.
Yeah, and there's some wonderful cognitive tools out there that I think are valuable that are going to be mainlined into healthcare, and we're all going to start understanding what does mindfulness mean, And I'm a big fan of positive psychology movement. There's a lot of those things, but I do think that mental health is now back around to getting the respect it deserves in a much more front and center way. Now it's about how do we pay for it.
Yeah.
And I think there's some good low-cost tools in place that can really help there. Yale's got this course on happiness, and I forget exactly what they call it, but
that's been widely promoted. I haven't taken it, but people love it.
Yeah. She has a podcast, And so I have gone through the whole course by listening to her podcast episodes. So it's just good little smart food for thought things to do. But I do think if we are catching people and helping them deal with their stress and cognitively work through some of their mental challenges, we're gonna come out of that with a much healthier economy and workforce, for lack of a better term.
Yeah. So I think there's no question that behavioral health and diet sort of are foundational to everything.
Yeah.
Like you don't have good behavioral health and you're anxious or depressed or worried or stressed, you end up having heart problems, diet problems, you don't exercise. There's a whole cascade of other physical health problems that are comorbid.
Yeah, you brought up a key thing is where I was going to go next, ironically, is on average, not every person, but on average, I think if we all lost 20 or 25 pounds, we would take an ungodly amount of billions of dollars of cost out of our healthcare system.
Yeah, and feel energy.
Oh, gosh. Yeah. Yeah, and that's one of the big things I've been studying the last few years. I think a word that's going around now is biohacking.
Yeah.
And biohacking and wellness. And I think that's been a personal focal point of me for the last year or two. Recovery. You heard me talk earlier about sleep, how my recovery and how I go about sleep versus napping versus extra hour sleep a night, all of this, how it helps me recover from mental and physical strain of everything I do. But I think something as simple was your annual physical exam. You know, I go every year, see my doctor. I'm in there 20 minutes or so. He takes a good basic lab test. He's an excellent caregiver, and I go and I'll get some basic information out of him. But now there's a whole nother level we could go to. There are blood and stool testing panels that you can send off and do now that give you this incredible rich trove of information. It tests many more biomarkers on your blood. It gives you a feedback on your gut health, on a lot of your heart feedback on that, and even what food types interacting with your personal genome can be better or worse for you to eat.
Right.
And so we could talk for hours on that. And I that's a lot of what my podcasting and books I've been reading the last year and a half have been on. And I just think that there's a whole world there about to explode.
Yeah. Well,
if somebody,
that's a transition from a healthcare system that's really misnamed, and it's about fixing us when we get sick is sort of what the healthcare system is now, versus a healthcare system that would focus on, let's optimize your diet and exercise and sleep and your wellness so that you don't get sick. Right? It's just a different, sort of the opposite mindset, but obviously it would be I think it'd be less expensive and more successful at getting you out there enjoying life more.
Yeah, and so I think, and nobody's really systematized this yet, and I just think that this whole, I'll call it this biohacking and personal wellness industry, I just think some fascinating things are going to happen there in the next few years. And,
what we're learning, the early adopters are out there and have been out there 5 years or so. I've been playing with, you've been playing with it. A lot of us that live this every day, we're testing things. And we're learning a ton right now that I think is beginning to be filtered into what we can bring to people that they don't want to experiment. They're not an early adopter. They're sort of in the main pack. They're mostly worried about getting their kids educated, paying their mortgage, getting a good life. And then can we bring them diet and exercise that is easy to implement and sort of pack.
Yeah, then you get little things like, as silly as this sounds, one of the big changes I've made in the last year and a half, first thing I do every morning is I spend a few minutes in a gratitude journal.
Yeah.
And for personal well-being, it just sets the whole day off. It relaxes me. And, you know, I'm sitting here as a consultant wondering when a lot of my new potential clients are ever going to go back to work so I can actually pick up some more business, and a lot to be stressed about. But, control what you can and deal with it,
Yeah, so for the, I mean, I've done this. I fell off the wagon doing it, but I did it for maybe like 90 days. But for the audience, talk to people about what you do and then what the benefits are over a week or two.
As far as my personal health,
journal in general and how it works, and
yeah. So I come from a Christian background, and I respect whatever background anybody comes from. So I have a prayer journal and a gratitude journal. And the first thing I do every morning is I spend about 20 or 25 minutes. I cycle through the prayer journal about once a week, and then I do one page on the gratitude journal. And it's three simple things. In my case, it's a verse from the Bible. What does that say to you today? What are you grateful for today? You just brainstorm everything you do, and then who's somebody I can serve today.
Yeah.
And then it gets me thinking about others. And then I leave that. That's actually the word mindfulness. We talk about meditation and mindfulness. Those are words that kind of have negative connotations to a lot of people. That's really what mindfulness is. It's just getting yourself centered and in a good spot and feeling good about what's going on around you and focused on others.
Yeah.
And then being a sports junkie, I then immediately go to the sports pages and see.
Right.
Of course, that doesn't take long these days. Yeah.
Okay. Good. And so, tell me, Bill, how do you stay current with all these fast-moving topics? I mean, so I feel like there's so much coming at us about what's happening in healthcare. How do you keep up with it?
Nobody's ever going to know everything, but I'm kind of a knowledge hound, a knowledge geek, if you will. And so, I try to get it from many sources. Every time you and I get together, I probably spend 10 or 15 minutes running questions by you, just see what you're thinking about certain things I've been pondering. And I'm the guy that gets on my daughter's nerves whenever we go to museums, because I'm going to read the real note on the placard under every picture and take 3 times as long as they'd like to getting through there. But I get a lot of general information from Bloomberg, Fortune, Forbes, and all of that, because I think if you understand more globally everything that's going on, you're going to be able to relate it more to what's that mean in the healthcare arena. Yeah. And healthcare specific, modern healthcare and his talk and a few industry listservs are always my go-to, but try to go as many of the events as the National Healthcare Council has as I can. And I listen to a lot of podcasts. Dr. Frist here locally does a second opinion, and he has some pretty interesting people he's interviewed on that. And so I just take it from every direction I can get it. And in general, I think if you stay fairly well read, and when you interact with other people, which I'm on meetings with a lot, make sure you spend a proper amount of time listening and not just talking. That's how you get there.
Things from other people too.
Yeah.
Okay, good. Anything else we should dive into?
No, this has been a great session. I just think it's going to be fascinating. We were talking about hospitals, and I think there's definitely a place there, and it's going to be interesting to me when we come out of this hangover and we start moving forward, what their focus is next. I wonder my bet is it's going to be the next spin in technology is going to be more on something that's going to make things more efficient in the normal operational, status quo. And I think the ones that are really going to win are the ones that are going to jump past that and say, how do I get ahead of the curve?
Yeah. I mean, what's the
going more aggressive?
That's a little bit.
Yeah. And with that, and I think you can, it doesn't take, you can spin up telehealth and some of these other things without spending a fortune. And I think the other thing is big data. We talked about business intelligence and big data. It was the buzzword of the year, 3 years running at HIMSS, which is very unusual. And we're not sure what it means, but people who can figure out how to do stuff like grabbing my data off my heart rate variability monitor that I talked about earlier and pulling information from other sources and making it, as I said earlier, easy to digest and easy to interpret, and then start using that in the flow of care are going to come out big winners in this.
Yeah. Well,
So I think the way data analytics evolve. Yeah.
Yeah, the key from my point of view is taking all that data, which is a massive amount, and turning it into kind of usable, actionable information. Like, can you figure out that bridge?
Yeah.
There's so much data out there. I don't care about that. I care about actionable information that I can do something with.
Yeah. Yeah. Can pull trends out of all of it.
Right. Exactly. Okay. Well, Bill, thank you very much. I really appreciate it. It was a fun time.
I so enjoyed it. And I think a lot of you and what you've done there, Vic, and I really appreciate you involving me.
Yeah. Okay. It was great. Thank you. Stay safe at home. Okay.
All right. See you later.